Hey, Mr. Hughes, how you doing today?
Good, how are you?
I'm doing good. I'm Zach. I'm gonna be the nurse with you today, okay?
Okay.
I need to get some vital signs on you, and then I'm gonna do a cardiac and respiratory assessment. Is that okay?
All right.
Alrighty. Alright, can I see your wristband? Can you verify your first, last name, and your date of birth for me?
Jared Hughes, 4750.
Alrighty. I'll wash my hands, provide privacy. Alright, we're gonna get your blood pressure first, okay?
Okay.
Now, do you normally have high blood pressure?
It's periodically.
Okay. Are you on any blood pressure medicine?
Yes.
Okay, which ones?
Lisinopril,
Mm-hmm.
hydrothiazide,
Okay.
and
Hydralazine?
hydrolysine,
Okay. Anything else?
and verapamil.
Okay. So you're on 4 blood pressure medicines.
None of them did it.
None of them do any good. Alright. If you'll bear with me, this is gonna get a little tight, okay?
All right.
Alright, it's a little high today. 162/78. Get that off y'all there. Alright, I'm just gonna document that in this chart. Alrighty. Next, I'm gonna get your pulse, okay? So if we can, we'll hold this across your chest. Trying to find it. Okay. Alright. I got a pulse of 72. Respirations of 18. They are even and non-labored. Alright. Are we in any pain today?
A little bit in the toe,
In your toe? Which toe?
a little toe.
Okay. On the left foot? Okay. What were you doing when that pain started?
Walking.
Walking. Okay. You must have stubbed it on something,
May
maybe.
have.
Can you describe what it feels like? Is it stabbing? Is it throbbing?
Just a little stabbing pain first.
Okay.
Throbs a little bit every now and then.
Stabbing and throbbing. You said that's in your left toe. Okay. On a scale of 1 to 10, 10 being the worst pain you ever felt, what would you rate it?
Well, about a 6.
About 6. Okay. Is there any aggravating factors, anything that makes it worse?
No, not that I've noticed.
Okay. Anything that makes it better?
How did I notice?
Okay. When did this start?
Yesterday, I guess it was.
Okay. Have you ever experienced this before?
No.
Okay. And does this affect how you're able to do things throughout the day? Have you noticed that you're not able to get around as well or anything like that?
No, it don't bother me that bad, no.
Okay. All right. I'm just going to take a quick listen to your breathing, okay?
Okay.
Every time that you feel my stethoscope move and touch you, I want you to take a deep breath in and a deep and blow it out, okay? Okay. One more time. Alrighty, Mr. Hughes, can you lean forward for me? I'm gonna do the same thing on your back. Alrighty. There are no adventitious breath sounds. Have you ever used anything called an incidence barometer?
Is it about that?
Okay, so it's a device that we use in medicine. What it is it helps us to open your lungs up, make sure we don't catch things like pneumonia, bronchitis, things like that, okay? I brought one with me today. This is gonna be your incidence barometer, okay? So how we use it, it's got a mouthpiece on it, okay? And it's called incident because you inhale, and it's got a little puck on it. When you inhale, that puck is gonna go up, and we set a goal level, okay? And that's what we want you to get to, okay? Go ahead and try it. Good job. Okay, and we want to do that 10 times an hour, every hour, while we're awake. Okay, sounds like a lot, so I just like to tell people every time you see a commercial come on the TV, do 2 or 3 of them, and that'll make it. You'll be just fine. Okay.
Yeah, it's opening up the lungs.
Right. Yep. Helps you to breathe. Have you had a cough or anything like that here recently?
No.
Okay. You're not hacking up anything, coughing up any mucus or anything like that?
No.
Okay. Have you experienced any shortness of breath, any chest pain, anything like that?
No.
Okay. Fantastic. All right. So, next I'm going to listen to your heart, okay?
All right.
All right. So, this first place, you're going to find the sternal notch, come down to the angle of Lewis, and come just to the right. This is your first point. This is your aortic valve. You're going to go directly across. This is your pulmonic valve. You're going to go to the next intercostal space, the third. This is Erb's point. You're going to go to the fourth intercostal space. This is the tricuspid valve. And then you're going to go to the fifth intercostal space on the midclavicular line. This is the apex of the heart at the mitral valve. All right, Mr. Hughes. Sounds good. So a stethoscope has 2 sides. It's got a bell and diaphragm. The bell side is used for low pitch sounds. So that would be if maybe we thought maybe we would hear a murmur or something like that. I would just flip the stethoscope over, but we don't have to do that today. All right. Now, I'm just going to feel your pulses on each side, make sure those are equal. Okay. Let me see your other arm. All right. Those look good. I'm going to put your feet up here so I can get to your ankles and your feet, okay?
Okay. I'm gonna kick my shoes off.
Yeah, you can. Go ahead. Okay. All right. Okay. Alrighty, our posterior tibial pulses are good. Alright, and our pedal pulses are good as well. So we have more pulses. So we checked our radial pulse. You also have a brachial pulse, an axillary pulse, a carotid pulse, a temporal pulse. You have a femoral pulse, that's in your groin. You also have a popliteal pulse, that's in the back of your knee. And then we also checked the posterior tibial pulse as well as the pedal pulse. Okay. So those were all good. All right, Mr. Hughes. Can I see your hands real quick? I'm just going to check your capillary refill. Okay, can I see that one? Okay. Have you noticed any swelling or anything in either of your arms?
No.
Okay, how about your legs?
A little bit of my legs.
A little bit in your legs? Okay. Do you feel like they're a little swollen right now?
Yes.
Okay.
What do you think?
Yeah, I do feel them a little swollen, but they're not, it's not pitting or anything like that, so.
Not extremely.
No, they're not, it's not bad. All right. Now I'm gonna take a look at your neck. You've got a vein in the side of your neck called your jugular vein, and we shouldn't be able to see it, okay? I will take a light, shine it on. Okay, can I see your other side? Same thing. All right, it looks good, Mr. Hughes. I'm gonna set you back up. And you said you're not having any kind of chest pain or anything like that, correct?
No.
Okay, have you felt any weird heart things, palpitations, heart skipping a beat, anything like that?
No.
All righty, well, everything else looks good. Is there anything else I can do for you today?
No, I guess that's about it.
All right, Mr. Hughes. Sounds good. Sounds good. Will you let us know if you need anything, okay?
All right, sure will.
All right.
Thank you.
Thank you.